When I was in the Air Force, there was the dentist I worked for. These guys were super athletes. And I said, that's all right for me. I started to practice in 1960, July 9th. There was a dentist in Macomb, and he died 3 years before I came here, and there was a very need for dentists. So when I opened the door, the people came in, and I'd been busy ever since. Moving was a wonderful surprise, because this building I designed myself. It was everything I ever wanted to work in. And if I was going to work all day, I wanted something I really liked. And if you notice, it's got wood floors, and I would not work on concrete. There's a lot of differences in dentistry now. It's not hardly even sort of related, because we got much better x-rays, we got much better instruments, and we got a lot of less things that causes pain now. Dentistry can be rather painless. There's been a lot of advances in dentistry. There's a lot more people going to the dentist, and there's a lot better dental labs for reproduction of dentures and crowns and replacement of tooth parts. Working with my daughter, Nancy, is a tremendous pleasure. She was good. We never had one fight. We never had one controversy about what I'd say was okay and what she said it was okay. We didn't have any indifference at all. And it was a good father-daughter relationship. She wanted to be boss, and I left her be boss. Macomb Family Dental loves people, and we don't turn anybody away, and we treat them as we'd be treated ourselves. And that was always my model. Treat people as you have them treat you.
Macomb Family Dental places the highest value on patient care. Because of this, we have invested time and great effort in finding a staff worthy of serving you. Our staff consists of dental hygienists, EFDAs, dental assistants, and a business team. Each play a unique role in making sure our patient care is excellent. Your dental hygiene appointment will be spent with our hygienists as they take any necessary x-rays, perform health screenings, scale and polish your teeth, and provide oral hygiene instruction. Our dental assistants have been extensively trained to assist the doctors in many areas, including sterilizing, handling instruments, and an array of laboratory skills. EFDAs, or Expanded Function Dental Assistants, are licensed to assist the doctors with a larger scope of treatment. EFDAs fill the surfaces of the teeth after the dentist has removed decay. They place the material and polish the surface of the tooth to complete the filling. The business team handles all aspects of administrative support for our patients. Our treatment coordinator will help you to understand your plan of treatment and the payment options available. Scheduling appointments, processing insurance claims, preparing billing statements, and providing a friendly face as you arrive and as you leave is our business team's primary role in patient care. While each member of our staff has a specific role, all of them have a common philosophy to treat each patient like family. Our patients leave here with more than a healthy mouth. They leave with friends that truly care about them.
My name is Dr. Kimberly Best. I am a dentist here at Macomb Family Dental, and I've been here for 10 years. Macomb Family Dental is unique in many different ways, in my opinion. The first thing I think that people notice when they come in our front door is our atmosphere, the way that we interact with each other, the way that we interact with our patients. We're just a very family-oriented, literally, practice. We strive ourselves at being the best. We push ourselves to be the best through technology, through continuing education, and just the way that we treat our patients like they are our family, and doing the best thing that we can for them every day, in and out. I decided I wanted to be a dentist actually while I was in college at Bowling Green State University. I had taken some classes and they were science oriented and was looking for the right field, and decided that this is an avenue I wanted to explore, and I'm so glad I did, because I can't imagine myself doing anything else. There were a lot of people that were instrumental in the process of me becoming a dentist. I don't think that's something you achieve as an individual necessarily. Probably the biggest and initial investment in my future career path would be from my parents. They encouraged me and supported me in all different kinds of ways, which I really appreciate. And my husband now was also very instrumental in that and support. We were together through dental school, and that was a big help. My philosophy for dentistry is basically the old school, the golden rule, to treat others the way that I would want to be treated, and to do, for their oral health the same thing I would want done for my oral health, and just to try to promote good dentistry, good oral health for the overall body. I decided to become a dentist because I feel like the ability to help people feel good about themselves and make them feel better about who they are is something that I can contribute to and make them happier all around. And I also really enjoy the people aspect of my job, getting to know them, getting to know their families, what they enjoy, and then they become more like friends than patients, and that's my favorite part of my job.
My name is Nancy Dysinger. I'm a dentist and one of the owners here at McComb Family Dental, and I've been practicing almost 30 years. So when I was in high school, I used to come and work for my father, who started this practice 50-some years ago. And I was one of his assistants. I also did some lab work, and probably best job of all, took out the trash at night. So working around patients and his staff then seemed like a fun environment to have a career in. The people that were instrumental in me becoming a dentist was obviously my dad. He's my mentor as a dentist. And I'm one of 5 daughters, and I was the only one that became a dentist. And I can't tell you, that's probably one of the greatest joys of my career, is working with my dad. He taught me how to treat patients and how to be successful. He always said, if you treated patients as part of your family, success will come your way. We have a very dedicated team, very experienced team. We have very low turnover with our staff. I think they enjoy working here with the doctors and their other co-workers. We offer the best technology available in the area. I always say it's a kind of a small town atmosphere with a big town flavor. One of the ways I interact with my patients is to try to make them feel as comfortable as possible. Obviously, nobody likes to come to the dentist. It's like not high on their priority list for the day, but they obviously want to maintain their smile, be able to speak, chew through the rest of their life. So they have to build a trust in the people that are providing the service. And I think if I can provide trust and comfort with them, then it provides a long-term relationship with that patient. God gave us a set of teeth well, 2 sets of teeth to keep for the rest of our lifetime. And through whatever circumstances, neglect, diet, they need our help. And our job is to help them maintain a healthy environment in their mouth and to help them keep their teeth the rest of their life here on earth.
At McComb Family Dental, we use state-of-the-art dental equipment and cutting-edge technology to assist in the diagnosis and treatment of our patients. The Velscope was created to be the most powerful instrument available for assisting in the discovery of oral abnormalities. This handheld device emits a light that enhances the contrast between normal and abnormal oral tissue. Oral screenings with the Velscope are quick, simple, and painless. We perform oral cancer screenings at all hygiene visits. This advanced technology is just one of the many ways we offer a unique quality of service at Macomb Family Dental.
I decided to become a dentist actually at a pretty young age. I was 10 years old, and it was when I was getting my braces put on. I really enjoyed the dentist that put my braces on me and realized it could be a happy, positive place and a good experience. And so I decided, that was the route for me, and what's better than giving people a smile. I was lucky enough when I was in school in the summertime and so forth to do a lot of job shadowing and to even work as a dental assistant in a lot of the area offices. One of those offices was Macomb Family Dental, and so it helped me fall in love with the profession, and I definitely fell in love with this practice and knew that this was the place for me. Macomb Family Dental definitely does everything that they can to give the patient a positive, comfortable experience, which I think is very important in the dental office, a place where people are oftentimes pretty nervous. So I loved it here, how everybody was treated as far as patients and how everybody treats one another when we're working together. I'm very lucky that I come from a very supportive family. I have very supportive parents that helped me to get through dental school, and my husband's very supportive. Our kids are great, and I've also been very blessed to come in and work with doctors like Dr. Arbogast, Dr. Dysinger, and Dr. Best. They've helped to mentor me tremendously, and I've learned so much here, just as much as dental school. Macomb Family Dental has just been a very comfortable experience for me. I love coming here. I love the fact that every patient is treated like a family member, and everything that we do is always with their best interest in mind. And that goes from the front desk to the assistants, the hygienists, and the doctors. Everybody has that same philosophy, and I love that about this office.